Are you worried about mom living at home alone? Are you worried about her safety? What if she falls? Are you curious to learn safer living options for her? How much does that cost, and how do you get there? Hi, I'm Randy Ihara.
And I'm Dan Ihara.
And welcome to the Advisor Podcast. We are real estate wealth advisors here in Hawaii, and in today's episode, we'll be discussing senior living options, or SLO. To help answer these questions, we have a very special guest, Julie Ihara.
Hello.
So Julie has experience serving families for over 2 decades, and she specializes in working with seniors, especially in the area of their home and relocating to safer options. So, Julie, tell us, what is senior living options and why is it important?
Well, senior living options is just as it says, it's really to do with your home. And it's so your home where you're living, and it's related to seniors. So as we age, we may need more care. And so we look at different options that offer different levels of care.
And what is the problem? Why should people learn more about senior living options?
Yeah, I really have a heart for this area. The problem is that people remain in their home too long. So what happens is you're living in your home, you're living life, and your health starts to decline. And then what happens is the home no longer is the right place or the best place for them to live. And then some kind of health challenge may happen, and then it becomes an emergency situation. I have a story that's near and dear to me. It's about my mom. And she passed away in 2018. She lived a wonderful life. She was diagnosed very early on with Parkinson's disease, early 60s. But she lived a full life and very active life. And she passed away at 85. But anyway, so what happened was, for the first, I would say 15 years, she was very happy, healthy, active. And she had no health challenges, although her diagnosis, but she was fine and very active. And we had conversations because we work with different options. We had conversations about moving into a retirement community where she could age in place, and as her health starts declining, that she would have more care, assisted care, and eventually skilled nursing. But she said she wasn't ready for that. She was active, and she wasn't ready, too young and too active, so she didn't really want to do that. Long story short, fast forward, she eventually did need some care in terms of helping to walk, but she was still able-bodied. We did bring care into the home, but what we didn't know was that she was starting to fall. So when no one was around, every once in a while she would fall, and she didn't get hurt, but it was just not a safe place. So we didn't realize that the house was not a safe place for her. So what happened eventually was she did fall, and one of those falls, she broke her hip. And that was devastating. So she went to the hospital. She had to have hip surgery and then go into rehabilitation hospital where she had to rehabilitate. And what happened from that point was it became an emergency situation. The doctor basically said she cannot go home in the condition that the home is in. It needs to be retrofitted. We need to bring care in. We need to bring 2 full-time caregivers, which is very expensive. And so she wanted to remain in the home. So we thought about how we could get that done. And so what happened was she wanted us to care for her, which was also another logistical thing that we didn't really think about. So my sisters and I, we went through training on how we could transfer her. So we had to transfer her from the bed to her wheelchair. And what happened was, it was very difficult. We're not trained in it. We don't have the skill set for it. And so what happened is, when we were transferring her, we almost dropped her. And so as we were transferring, and it freaked her out. I mean, she started screaming, and she just said, no, don't do it. You're going to drop me. And that was the end of the story. She basically said, I don't want you folks, you are not able to, and I don't feel safe. So to summarize the story, basically what happened was my mom wanted to remain in the home as long as she could because she loved her home. But what happened is, as her health declined, the home was no longer the best place for her or with the right care. And so what happened was an health event happened. She fell. She had to have surgery. And then it became an emergency situation, which we had to quickly make decisions, quickly find help. And we were very much in a reactive state where we had to figure out what to do in a short period of time. And it was very stressful.
Yeah, no, that's a very good aha, because a lot of times, families, parents, they want to stay in the home that they've lived in so long, but is that place, a safe environment for them to thrive in, right? We don't want to just survive. We want our clients to thrive in the environment that they're living in, right? Having social connections, right? And that's why we preach so much on, communities, right? Because we want them to be mentally stimulated where they can thrive in their communities. So why do you think, or what causes people, you think, to stay in their home too long?
Actually, there's a stat that says 70% of people want to stay in their home until they die. But in reality, it's only 30% that actually do. And so I think people want to stay in their home because it's comfortable, first of all. But the other thing is that there's an assumption or maybe denial that as we age, we're going to need more help.
Yeah, that's what we notice most, is that most of us, myself included, we're all kind of in denial, right? We see the past very clearly, but we have a hard time seeing the future. As we get older, we're almost afraid of the future. We don't want to have a conversation around ailing health and the demise at the end.
Yeah, I think it's a scary conversation on both sides to have, right? But I think the question that we always want to prompt to our clients is, would you rather be proactive or reactive, right? Do you want to get ahead of it and have that conversation before you need it? Or do you want to be reactive and thinking about all the stress that puts on your kids that have to drop everything, their work, their relationships, because they have to take care of mom in that stressful situation? I think it's just a whole thing that we always, recommend our clients being proactive and getting ahead of that before they actually need that. So how do you think, or how do you help our clients self-discover, that home may not be the best place for them?
Right. I think the biggest thing is people don't know when they should leave their home and people don't know where to go. And once we can answer those questions or help them to self-discover based on the level of care they need, based on different factors, then it becomes a lot easier. So we actually look at 5 different categories to help people to discover when the home is no longer the right place for them. So one of the first thing is health. So health could be physical health, mental health, cognitive, memory challenges, for example. And so some of the things that we'll ask our client is, if they've had any recent falls, or if they're worried about security, are there things that they're worried about? Or maybe that they forget to take their medication, or they're forgetting their appointments. So it's signs of decline of the health. And this is something for the adult children, when you see your parents, this is something to make a note of, or even ask them questions to check in on them and see how their health is. The second thing is home safety and sustainability. So the home itself, is a home set up appropriately? Is it set up for aging in place? And so some of the questions that we would ask them would be, do you have too many stairs? Is your home no longer, is it, too much maintenance? Is it too large? Because us kids, we've moved out. And are you tired of cooking and cleaning? That's me, so.
Yes, she is. I'm going to agree with that one.
Yeah. So the next area is family support. So really, is it realistic for the children or the family to take care of the loved one? Are you trained in it? Do we have the right skill set? How long will we have to do that, and how frequent? And so it really could make a big difference in your lifestyle. And is it really realistic that somebody could take off work or not have to work to be able to take care?
Yeah. There's quite a few clients that, they say, oh, my kids will take care of me. And we ask them, do your kids know that? Right? Because we put those assumptions on our kids that, they'll be there for us, but they don't understand necessarily the commitment to take off work, right? To care for them, to take care of, to drop the things that are in their life to support their parents.
Right. Randy, are you going to take care of us?
Well, that's what they call the sandwich generation, right? The generation that are the adult children and they're taking care of mom and dad, but they're also taking care of their kids.
Absolutely.
And that's the most challenging generation right now.
Yeah.
Right.
And if you're here listening or watching this, just know that there is support, there is help.
Absolutely, absolutely. The next area, the fourth area, is financial stability and real estate planning. So how are people going to pay for the care? You know, it does become quite pricey as the level of care increases. Do you have long-term insurance that can help you to offset the cost of it? Or is there equity in your home that you could use and pull out and draw to help you pay for your care? And then the last area is future needs and timing. So, you know, one of the questions we do ask is, would you like to make the decision to move your decision, or would you like somebody else to make that decision for you? So would you like to make the decision while you're still able to make the decision? And so that speaks to planning, and we're really believers in planning.
Yeah. One of the challenging memories that I have regarding a client came to one of our seminars and said, "Dad, I'm okay," until one day I get a call from him, and he said, "Dad, I need to see you. Can you come and see me?" And I said, "Where are you?" And he said, "Well, I'm in a hospital." So, why are you in a hospital? So, what happened? He said, "Well, come over and I'll tell you more about it." So I get to his hospital bed, and he actually fell down in his own home and he broke his hip. But he's still alive, and through the blessing of God, that, you know, it was on a Saturday and he fell down on Saturday afternoon. Sunday he didn't go to church, and so on Monday the pastor went to go see if he's okay, because he'd always make it to church, and he didn't. So fortunately, the pastor knocked on his door. He heard him scream on the inside. He broke the door down to get to him, and he was lying on the ground. But when I got to his bedside, he told me that, "Dad, I need your help." I said, I'll never be able to see my house again. And that's tough to have to be part of, right? Somebody that had a choice to make a decision but chose not to because they thought it was okay, and then it wasn't, and something bad showed up. And so we had to actually go through his house and find all of his trust documents and all of his financial records. He never ever saw his house again. And he relied on us to be his conservator, to protect him, to look after everything that he had.
Right.
And so I remember we went in and he asked us, right? We'd go to the hospital and he'd say, "Hey, could you all go home and get this? Can you home and get that?" And so we'd go filter through his house to get it, and we brought it to him, and there were boxes of books and memorabilia that he wanted.
Yes.
And then he was in the hospital for a while. Then he came out. He went to a rehab care facility. And then we would take him ice cream because he used to love ice cream.
He liked milkshakes.
Yeah.
He still does.
He still does, yeah.
Yeah.
But, you know, that's the story of somebody that said it was okay until it wasn't. And then that time was unfortunate because he didn't have a choice in the matter. His choice of moving on was taken away from him just because of a simple accident.
Right. Yeah. That was a tough one.
Yeah, and it's pretty scary to think about, you know, if he fell on Saturday, the pastor didn't get him until Monday. That means he was on the ground, laying on the ground for 2 days.
Yeah, you know, the doctor said if it was another day, Randy, he may not have survived. Yeah. Your body can't survive without fluids. And it was sad. And just imagine his experience, right? Being in your own home, not being able to move, nobody can help you. And God was there to bring his pastor along to knock on his door. I said, you're not done yet, you know? You're not done yet. But yeah, that's the reactive person, unfortunately. But then there's the other side of the story, right? There's a proactive person. And that proactive person says, I'm going to go while I can, while I know it's better for me, right? And so, remember the one up on Diamond Head?
Right. So we had a couple, and they were healthy, happy. The husband worked every day and hard worker. He was a doctor, physician. And they decided that they wanted to plan ahead. So they cleared out the home, and we helped them with all the things that they needed to move. And they decided to move into a retirement community, which is a CCRC, continuing care retirement community, with all of the different levels of care, which we're going to go into in a next. But basically, they went in and they were independent, and they were able to move in. And then as time went on, the wife became ill. And so she needed more care. Meantime, the husband is still healthy and working, but she needed some more help. And she eventually went into assisted living and then into skilled care. And then she eventually passed. The husband is still, was very active for many years. And then he actually passed away as well. Probably, but at least, 3 or 4 years later. It was a while after.
Yeah, what I didn't know, though, because she seemed fairly healthy at the time, but, many people will have an illness. The doctor will let you know something, but most of us, we don't like to tell anybody, right? And that was the case for her. She was ill for a number of years. When we talked to their son, they said, mom and dad knew about this. And so they were planning ahead, right? And so that was a proactive person that they could make their move together as a couple, right? They could downsize and declutter together and make their transition together and meet new friends together. And so when she passed, he had a safety net of support system right there.
It's so much easier to do together than to have to do that all by yourself after your loved one passes away.
Yeah, 100%.
Yeah. So tell us, there's different levels of care. There's 4 different levels of care. What are those? Could you explain a little bit about the different levels of care?
Okay, so there's 4 different levels of care, as Randy said. The first one is independent, and we talked a little bit about that. So where you're still able-bodied and you can come and go. So we're talking about, those would be retirement communities. The next level of care is assisted. So what we talk about in assisted is activities of daily living. So we also short ADL for short, but activities of daily living. And there's 6 activities of daily living. There's bathing, dressing, eating, toileting, transferring, and continence. So when you need 2 out of the 6, and that's activities, maybe you need help bathing or you need help eating. When you need 2 out of the 6, then typically you would go into assisted living. The next level, as you need more care, would be skilled care. Now, skilled care is where it's usually medical. It's some kind of intrusion, but you need medical help. And you're usually not, it's not in an individual room. You're usually in a different floor or a different area in a retirement community that specializes in skilled care. And so examples would be, so the story about my mom, she would have been assisted living. When she moved into a care home, it was assisted. She needed help with the ADLs. But there was a story on the skilled care, I think, on the...
Oh, the guy in Pro City?
Pro City.
Yeah. So our financial planner calls me and says, hey, Dan, I have this couple that they paid for the CCRC, which is Continuing Care Retirement Community. They actually paid for it. It was hundreds of thousands of dollars. And they paid for it, and they've actually been paying monthly. And I go, and so why didn't they move in? I said, I don't know. I can't get them to move in. So I go to his house, and I get to the house, and he lets me in the door, but he's in a walker. So he's frail. His mind was very sharp, but he was frail and skinny, and he looked malnutrition. Right? So he gets there, and he walks to this chair, and he sits down, and I turn around and look at the door. There's like 6 different locks. I go, wow. How come you have so many locks on the door? She said, well, my wife, she got lost. And that's why we decided to do that. She got lost, and she was standing in the 2 yellow lines in the middle of the street in front of her house. Wow. And she was lost. And it was like, holy smokes. He said, well, that's why I felt we should do this. So he put the money in. And then so he's sitting down, and I go right up to him. I said, hey, I understand you paid for it. How come you didn't move in yet? And he says, well, Dan, you don't understand. I bought this house when we got married. We've never, ever moved. I don't know how to move. And so I jokingly, in my humor, I jokingly said, say, what if I wiggle my nose and I got you there and everything was what you needed? And you should have seen, he was like this. He goes, when can I go? It was so funny. It was hilarious.
I didn't know you had that skill. Can you do that for me? I'm gonna request something.
Yeah, right. But yeah, he's like, wow, when can I go? I said, well, maybe in the next week or so we can actually get you there, and we'll take care of all your stuff, and we'll clear out the house, and we'll get it sold. I said, wow, you could do that? I said, yeah, absolutely. We actually got him to the retirement community. His wife at that time had memory challenges, right?
Right.
But when I was at the house, Randy, it was kind of scary. She came out once, and she started barking, kind of like speaking really loud. She was a big lady. And this is a small Japanese guy. The wife was big. She looked like she could have hurt me if she got mad, It was a little frightened. But she went away, and he said, yeah, she's okay. But I think we really need to get her into retirement community and get her into memory care. And then they moved in. And she was fine. She's in memory care. And then we find out that a couple months later he had passed. Mm-hmm. And so we went to his funeral. And that was tough. It was really tough. Going to the funeral, what was really rewarding was the nephew, who was a sheriff, big burly guy, right? And then he was really nice. We had talked to him, and he had helped us with the transition. He comes to give me a big hug. He says, "Thank you so much for doing that." Because he said, I don't think I could have gotten Auntie out of the house. That's a big burly guy. He's thinking, and he told me that, if it weren't for your help to help her get to that place, I might have had to put a straitjacket on her, and I can't see myself doing that. He said, you helped me get her there into a safe place. And he said to me, this was Uncle's most important part of his life, is taking care of his wife. And so it was just really rewarding to know that, yes, we're in real estate. Yes, we sell real estate, but we do much more than that. We help people change lives. We help them get to a better space of life, and it has a trickle-down effect. It doesn't only impact the parents who are living there, the nieces and nephews. They never had kids. Mm-hmm. And so the nieces and nephews became their kids. And he just said, wow, you changed our family's life. And that means everything to us.
Yeah.
Absolutely.
Yeah.
Yeah, I think a lot of, people listening out there, they understand that maybe they need help or they need care, but they just don't know their options, right? They don't know where to go. So what are those options for people out there?
Yeah. Well, so the last level of care actually is memory care, which we just talked about, dementia or cognitive problems. The options we have been talking about, retirement communities are one. But prior to that, it's aging in place. So most people want to age in place. So that is a consideration. So those are the things that you would ask yourself, is our home set up appropriately for it? Can I have a wheelchair in it as we age? Do I have too many stairs? So is a house ready for it? And who is going to come into your home to help care for you? Is it going to be your family? And we talked about those questions and possibilities as well as challenges. And then it could be paid care. So you could bring care in and pay for care. And there's all different sorts of care. There's just to help you with household chores. And then there's in-home health care, where you need a little bit more, medicine management, a little bit more help. And then it gets very pricey if it gets to the skilled level, where it's going to be much more than any of the other alternatives because it's private care and you are pretty much the only person. Yeah. So as opposed to if you're in a retirement community or in a care home, the cost is split with the different patients.
How much is that cost about? If you were to bring skilled
care
nursing care into the home?
I have my cheat sheet here. Do you know off the top of your head?
Roughly 24-hour care is going to be about $20,000 to $25,000 a month.
Yeah, I think
$25,000 a month.
Yeah, a month
for skilled nursing care.
Wow.
Yeah.
I think the average in Hawaii is about $22,000, and that's just the average. So it could go higher. Than
How does anyone pay for that?
Well, at that point, the home is not the most financially feasible option. Right?
Yeah.
You're going to want to go to a care home, an adult residential care home. That could cost maybe $4,000 to $6,000 versus $20,000 to $25,000.
Holy smokes.
Right.
At that point, But we do have clients that have
Right.
more money than they can spend. So hey, so be it. You can choose to age wherever you want, as long as you have the financial resources. And that's kind of one of the things that we cover when we create real estate plans, is to look at the financial side, just to make sure that you're not going to run out of money.
Right.
Wow.
And in addition to that, sometimes you need more than one person. So in our case with my mom, the doctor said we need 2 full-time people 24/7, which it was, quite high.
Yeah.
to
So for
pay
people that, can't afford $20,000 a month, what other alternatives are there?
So we've been talking about retirement communities, which we are a fan of. So when you think about a retirement community, think about it like a cruise ship. You go on a cruise, you have your meals taken care of, you have your linens taken care of, your bedding washed, and you have all these amenities, and there's entertainment, and there's social activities and things that you can do. And as we mentioned, there's different levels of care. So you have different retirement communities that offer different levels of care. So you have a CCRC, which is Continuing Care Retirement Community, and they have the independent, the assisted, the skilled, as well as memory care. And then you have the other retirement communities that maybe just offer assisted living, independent or assisted living. Another type of retirement community is more with the financial model. It's either a buy-in community or it's a month-to-month community. So a buy-in community would be something, in Hawaii we have 3 buy-in, and they're called life care plans. And basically what you're doing is you're putting a large amount of money down up front, with the idea that you're buying a life care plan where they're going to take care of you for the rest of your life. So as your health needs increase, they're going to take care of you, and you can remain in there until the end. The month-to-month is more like a rental. So you'll go in, you'll pay your initial community fee, and then you pay a monthly fee. And if you decide in 2 or 3 months you don't want to be there, you want to move somewhere else, you can do that. And so they have different models for different people depending on your situation. So there are choices. And then
Adult residential care homes.
yes,
Yeah. Arches.
right. So that's the third area. So aging in place, and then you have retirement communities, and then you have the adult residential care home, which are ARCH for short. And the care homes usually start with a little bit more help. You need help with your ADLs.
It's a single family home in many of the neighborhoods in our market here in Hawaii. It's a family that has a house.
Right.
And they've got 5 bedrooms, and
Right.
each person has their own room, and they provide food and care, and it's all inclusive.
Right.
So it's cheaper than staying home, right? If you're asking financially what's the best route, that's where typically most people go. And there's thousands of them out there. There's just a lot of choices to come from.
And then after that, if they need a little bit more care, then there's the EARCH, which is the expanded care. So that would be if they need more medical attention, if they need insulin, or if they need oxygen, wound care, then that would be another alternative as well.
Yeah.
Yeah.
So for families out there that are listening, how do they know which option's best for them and their family?
I think it would depend on health. Well, various things, health, as well as do they have projected needs, like for that couple that they knew that the wife wasn't well, and eventually that she was going to need some more care, as well as financial. So there is a balance. So what we will do is we'll sit down with the client, go over the situation, what their goals are, what their financials look like, what their family, just kind of all of the different factors, and then help them navigate the options.
Okay. Yeah. And how about the different retirement communities, different places? I know you guys spoken at a bunch of the different retirement communities in the past.
Yeah. I think each person is going to be a little different, right?
Yes.
Depends on, we usually ask, have you visited any of them? And what do you like to do? Where do you go? What most people don't want to do is they don't want to travel far, right? And so, if they live in a town area, they're going to want to have some place to live in town where they can see their friends and family and things like that. I think the national statistic is they don't move farther than 7 miles from their home, typically.
Right.
Yeah, because they want to stay close to wherever they're used to
That
or
makes
they're
sense.
comfortable with.
Yeah.
And then it goes down to basically on the needs of care,
I see.
today and tomorrow, and your
Yeah.
future projected needs. And yeah, so everyone's going to be a little different.
Okay.
We suggest that when we meet with our clients that we have a series of questions to ask regarding their health, their finances, their family. And at the end of that, they'll kind of narrow it down to a couple. And then oftentimes we'll take them on a tour to see what it's like, maybe even have a meal there to see what the food's like. And then finally make a decision based on which one would be the best fit, right?
Right.
And then they can decide from there.
And it's interesting. Each community has a different personality.
Yeah.
It's like a different hotel. Each hotel, they offer similar services, but they all have a different personality. So it's very important to go and visit and experience it.
Yeah. It sounds like we're doing a lot more than just, selling real estate.
Yeah, certainly. Yeah, it's really about a transition of life.
Absolutely.
As we get older, our needs are going to rise, and our health care is going to be addressed, and we need to have solutions. And over the last 20 years, we were able to do that. In every retirement community on our island.
Wow.
Yeah, we have clients in all of them.
Yeah.
Yeah.
And it is more, but you know what? It's so rewarding.
Yeah.
You become part of their family, and it's so rewarding.
Yeah. I tell people it's one of the few jobs that you get a hug every day at the end of the day. It's kind of cool. Yeah, it's more than just money.
Yeah.
We're building relationships, and we have families that are getting close to us. So it's very rewarding.
Yeah. What's one takeaway that you guys learned from your experience that you think our audience should hear?
I think it goes back to the beginning, and what we talked about was really to be proactive instead of reactive. And if you're not intentionally proactive, you are being reactive. So whether it's denial or you don't know the information, but it can make a huge difference in how the outcome is of, for your loved one as well as for your family. And
One of our clients, I asked her, well, she was healthy, Randy, and she was probably in her 70s, and she was moving to a CCRC. She's putting a lot of money down. I asked her, so what's causing you to want to do this? Because she lived in a house with 78 steps. And every day she would walk down to say goodbye to me and think, wow, and this is so awesome. Like, you're so healthy. What's causing you to want to move in? And she says, I don't want to be a burden to my kids. That was a big aha for me. For those of you who don't want to be a burden for your kids, the only way to do that is be proactive. Reactive people will eventually, unfortunately, be a burden to the people that they love the most. And that's unfortunate. Not willingly, not intentionally, but it just happens that way.
Yeah.
So we're advocates of being proactive.
Yeah, that's really good. It's really good.
Yeah.
So yeah, any final thoughts? Julie, thank you for joining us.
No, my pleasure.
If you're interested in creating a plan for you and your family, go to the link in the description or visit iharateam.com, and we can help you understand your options, the steps needed to make the transition, and answer any questions that you or your family may have regarding taking care of a loved one.
Thanks for tuning in to the Advisor Podcast. If you got value from today's conversation, be sure to check out our previous episodes to learn more about how to help families build, protect, and pass on wealth through real estate. We'll catch you in the next episode. From our family to yours, happy Thanksgiving.